About 59,000 years ago, somewhere in southern Siberia, a Neanderthal had a toothache. Not a small one. Not the kind you ignore for a day. This was the kind of pain that takes over your whole face. The kind that makes it hard to chew, hard to sleep, hard to think. A molar deep in the jaw had developed decay. The damage had gone far enough that the tooth may have become a constant source of pain. There was no dentist, no x-ray, no numbing injection, no clean white room with a chair that leans back. But someone tried to help. A sharp stone tool was placed against the tooth. Then, carefully, painfully, the damaged area was drilled or scraped. The goal was not beauty, it was survival. Because in the ancient world, tooth pain was not just uncomfortable, it could kill you. And this raises a question we almost never think about. Before modern dentistry, how did ancient humans survive one of the most common pains in human life? The answer is stranger than you might expect. They endured it, they explained it, they treated it, and sometimes, thousands of years before dentists existed, they performed procedures that look shockingly close to dentistry. To understand ancient tooth pain, we have to understand that ancient teeth lived harder lives than ours do. Today, teeth are mostly for eating, but for ancient humans, teeth were also tools. They held animal hides, they softened fibers, they gripped objects, they helped process food long before machines, knives, and mills did most of the work. That meant ancient teeth were often worn down brutally. Not always rotten, worn. Ground down by tough plants, gritty flour, sand, stone particles from grinding tools, and years of chewing food that had not been softened by modern processing. At first, that wear might not seem like a problem, but once enamel is worn away, the softer layers beneath are exposed. A tooth becomes vulnerable, sensitive, painful, and if bacteria entered the damaged area, the pain could become something much worse: an infection, a swollen jaw, an abscess, a fever. A problem in the mouth could become a problem in the whole body. So, for ancient people, tooth pain was not a minor inconvenience. It was a warning that something inside the body was going wrong. Now, think about what that meant in daily life. If you could not chew, you could not eat properly. If you could not sleep, you could not hunt, gather, travel, work, or protect yourself. If your face swelled, your group could see that something was wrong. And if the infection spread, there was only so much anyone could do. This is why tooth pain created one of the oldest medical problems humans ever faced. The problem was hidden. A cut on the arm could be seen. A broken bone could be felt. But a toothache came from inside the jaw. Ancient humans had to figure out an invisible enemy. And one of the earliest explanations was simple. Something was eating the tooth. In many ancient cultures, people believed in the idea of a toothworm, a tiny creature inside the tooth, gnawing away, causing pain. To us, that sounds ridiculous. But if you had no microscope, no germ theory, and no understanding of bacteria, it actually made sense. A tooth with a hole in it looked as if something had burrowed inside. The pain came in pulses, almost like movement. The tooth seemed to be attacked from within. The toothworm was wrong scientifically, but as a story, it gave pain a shape. And once pain had a shape, people could try to fight it. The first treatments were probably not surgical. They were soothing. People chewed plants, packed substances into painful teeth, used resins, honey, oils, herbs, ash, minerals, or animal products. Some remedies may have helped. Honey can resist microbial growth. Certain plants can reduce pain or inflammation. Chewing specific fibers could clean the mouth. Other remedies probably did very little, and some may have made things worse. But the point is not that ancient medicine was perfect. The point is that humans were experimenting. A person would try something. If the pain eased, the remedy was remembered. If the swelling went down, the story spread. If someone survived, the treatment became knowledge. Before medicine was written down, it lived in memory, in families, in healers, in repeated attempts to solve the same terrible problem. Then, at some point, humans stopped only treating the pain around the tooth. They went into the tooth itself. At Mehrgarh, an ancient site in what is now Pakistan, archaeologists found molars with tiny drilled holes. These teeth date back roughly 7,500 to 9,000 years. The holes were not easy to reach front teeth. They were molars, the difficult ones, the painful ones, the ones at the back of the mouth where decay can hide. Researchers believe the drilling may have been done with flint tips, possibly using a bow drill technique similar to tools used for bead making. That detail matters because it suggests early dentistry may have borrowed technology from craft. The same human skill used to drill holes in beads could be turned toward the body. A tool for making ornaments became a tool for relieving pain. But think about the trust required. Someone had to sit still. Someone else had to place a sharp tool inside their mouth. There was no modern anesthetic, no guarantee it would work. The patient must have believed the pain of the procedure was better than the pain of the tooth. That tells us something powerful. Ancient dentistry was not only about tools, it was about cooperation. It required one person to suffer and another person to help with precision. That is not primitive. That is deeply human. Thousands of years later, in what is now Slovenia, another tooth tells another part of the story. A human jaw dating to around 6,500 years ago was found with beeswax placed into a cracked tooth. This may be one of the earliest known examples of a dental filling. Not a filling like we get today. No polished surface, no dental resin, no drill and seal appointment. But the idea is familiar. Something was wrong with the tooth. A material was pushed into the damaged area. The goal may have been to reduce sensitivity, protect the exposed surface, or ease pain. And beeswax was a clever choice. It is soft enough to shape, sticky enough to stay in place, and available to people who knew how to gather or use products from bees. Again, this was not modern dentistry, but it shows the same basic thought. The tooth has a damaged space. Fill the space, protect the tooth, reduce the pain. That idea is thousands of years old. In ancient Egypt, dental pain became a written medical problem. Egyptians suffered badly from worn teeth, partly because bread could contain grit from grinding stones and the environment. Over time, that wear could expose the inner parts of teeth and cause severe pain. Egyptian medical texts included remedies for dental problems. Some treatments mixed practical ingredients with magical thinking. That may sound strange, but in the ancient world, magic and medicine were often not separate. A healer might apply a substance to the tooth and recite words against the force causing the pain. To modern ears, that sounds like superstition. But emotionally, it served a purpose. Tooth pain makes a person feel helpless. A ritual gave the sufferer a sense that the pain was being confronted. The body was treated, the fear was treated too. And that combination matters because pain is never only physical. Pain also creates panic. Ancient healing had to deal with both. Eventually, when a tooth could not be saved, there was one final option. Remove it. Tooth extraction is ancient, brutal, and sometimes necessary. If a tooth was loose, infected, or damaged beyond repair, pulling it out could end the source of pain. But extraction came with risks: bleeding, broken roots, infection, damage to the jaw, and of course, the immediate agony of the procedure itself. Still, for many people, losing the tooth may have been better than keeping it. That is the harsh truth of ancient tooth pain. Survival did not always mean curing the tooth. Sometimes it meant outlasting the pain. Sometimes it meant dulling it. Sometimes it meant draining an infection. Sometimes it meant drilling, filling, or pulling. And sometimes it meant accepting that the body would carry the damage for the rest of a person's life. The strange thing is that teeth preserve these stories better than almost anything else. Skin disappears, muscles disappear, voices disappear, but teeth remain. A drilled molar can tell us someone tried to intervene. A worn tooth can tell us what a person ate. An abscess can tell us they suffered. A filling can tell us someone attempted repair. A jaw can become a medical record. And when we look at ancient teeth, we see something more than disease. We see problem solving. We see care. We see people refusing to simply accept pain as fate. Long before dental schools, humans were asking the same questions dentists ask now. Where's the pain coming from? Can it be cleaned? Can it be sealed? Can it be removed? Can this person keep eating? Can they survive? Today, tooth pain sends us to a dentist. A bright light turns on. A scan reveals the problem. A trained professional numbs the area. The tooth is repaired with tools ancient people could never have imagined. But the basic human story has not changed. A person in pain opens their mouth and trusts another person to help. That moment is ancient. It may go back tens of thousands of years, back to stone tools, back to beeswax, back to herbs and rituals, back to people who did not understand bacteria but understood suffering. So how did ancient humans survive tooth pain? Not easily, not painlessly, and not always. But they survived it with observation, with endurance, with plants, tools, fillings, and extractions, with stories that explained the pain, and with communities willing to care for someone whose suffering could not be seen from the outside. That may be the real lesson hidden inside ancient teeth. They do not only show us how much pain humans endured, they show us how early humans began fighting back. Before dentistry became a science, it was an act of trust. One person in pain, another person trying to help, and between them, the beginning of medicine.